Well, I'm talking with the Minister for Health, David Anderson, and a developing story all the time, really. Mr. Anderson, I think it'd be best maybe to go right back again, because we've talked about this before, and there's developments even this morning. I know you'll come to that. But can we go back to when this procedure was stopped, why it was stopped, and, you know, is it going forward now and so on, please?
Okay, yeah, so basically there were 3 or 4 operations that went slightly not to plan within a short time frame. So Noble's management team and the medical director decided to suspend elective bowel surgery while they called in some independent experts from teaching hospitals in the UK to say, are our procedures up to scratch? Do we need to do anything to improve our procedures to make sure that patient safety is as good as it should be?
Now, you called that. I mean, you went in there and stopped it. If there was no leaks, there was no sort of...
No, the medical director and the hospital management decided on that course of action, and that's nothing that unusual. That's what happens in hospitals up and down the country. If there's a slight problem, the management decide, let's investigate this. Is this a blip, or is there something we need to learn from it?
Well, maybe we'll keep with this one subject to start with. You suspended it, you got people in, they've made their report. Part of that, of course, then has leaked out. Yeah. Do you want to deal with that bit?
Yeah, obviously these are internal reports for the medics within Noble's Hospital, and normally they aren't leaked out. It was unfortunate because I think we have to acknowledge that management did the right thing by suspending elective surgery. In the meantime, our patients needing colorectal surgery went to Liverpool Royal for their operations over a period of time until the steps that were put in from the recommendations allowed us to continue bowel surgery at Noble's Hospital, which has happened now. You
started again. You've had this report. Part of it's been leaked, but has anyone been suspended, removed, sacked, or whatever? I mean, what confidence level should people have at this moment, especially after this leak?
Well, we've met the recommendations, the short-term recommendations, the longer-term recommendations about further training for people working within that area. That is ongoing, okay? But it's unfortunate that part of the report has been leaked, which has been highly selective, and that has given a distorted view of the whole issue. It didn't say that once you put these in place, the operations can go ahead, for example. So it's been a very selective cherry picking.
And clearly the bits that people were going to pick up on. I mean, that's what a report does, isn't it?
It is, but you don't need to see that without seeing. If you don't see the rest of the report, you don't put it in context.
But we won't see the rest of the report, will we? Because it could name patients and all sorts of confidentiality things. So
that's right. You won't. But I mean, what the department has taken the decision, because it has been leaked, selective bits have been leaked out, that the action plan that's been put into place should be put on the Department of Health's web page so people can see exactly where we're up to with this.
Now that's new information, right?
It is.
This has just been decided, has it?
Yes. I mean, normally such reports are confidential to the medics within a hospital. But because this has been leaked and only certain parts of it have been leaked, it's been decided the best thing is to put the whole action plan on the department's website so people can see what we're doing and where we're up to with this.
And you can see from the people who made the leak, therefore, this has brought you to make it more transparent, because if the leak hadn't have happened, you wouldn't be putting this action plan on the website.
It's only because certain selective bits of the report have been put out into the public domain that public confidence might be questionable. So that's why we need to make sure that the general public are aware that we have put into place actions that give further confidence that our safety in this area is as high as it can be.
But if there hadn't have been the leak, you would not have been taking this step, right?
We have an action plan. Regardless of a leak, there was an action plan put in place that would enable our services to be delivered in the safest possible way.
But you wouldn't have made it public. You wouldn't have put it on the website if there hadn't have been the leak.
We don't release these, as I've said to you earlier on in this interview, these investigations into areas that there are hiccups within different areas in medical practices throughout hospitals in the UK regularly do these reviews and get people in outside from teaching hospitals to review, are procedures correct, are they being done correctly. So this is something that happens on a day-to-day basis throughout the UK, so you wouldn't publish them.
So you have been forced into this situation?
We have been forced to do it because there's selected bits of the report have been leaked, which is not fair because it doesn't give the whole picture.
Okay, now looking at those bits that were selectively put into the public domain, I mean, there's a worry there for some people, surely. And has anyone had any action besides you saying retraining? No one's been sacked, no one's been suspended, nothing like that? No. Some people are having further training before they recommence their colorectal surgery. That's not anything unusual, okay? But what I should say is that people should have confidence that we've put the steps in to rectify the areas that were giving concern to the person that came in from the outside and had a look at our whole operation. I should probably say here as well that, you know, this is somebody from a leading teaching hospital in the UK, and the terminology that he used was terminology for the medics, not for you and me as lay people. So our understanding of the phrases that were used and medics are quite different, and that's why when the information on our action plan is going to be published on our website, it will be in layperson's terms, so we can understand that the abbreviations won't be used. For example, there'll be the full term, so people can understand it more clearly. Do you think this is it now then?
Well, I don't know. Mrs. Beecroft has decided to resurrect this again. She's brought back an old story and saying that I'm misleading. I haven't been misleading, and I believe, as you're well aware, we've already referred ourselves to different Tynwald committees to make sure our interpretation of misleading and theirs is the same.
Okay, there's more to talk about and we'll have that in our next section.